CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
CURES show, where we explore cutting-edge wellness from credible sources. I know it's allergy season. We're happy that you're here because if you've got the sniffles, the sneezing, there are a lot of science-backed holistic treatments for your seasonal allergies. So in CURES, we have one of our favorites back, and that is Dr. Jennifer Stagg, founder and medical director of the Whole Health Wellness Center in Farmington. Thanks for being here.
Thanks for having me. Great to be back.
A lot of folks will think that they just have to suffer or take meds. Sometimes the meds might be okay, but they're not even that effective. You say some of the holistic treatments you have work even better than the medications.
Yeah, I mean, we've been doing this for so many years, and I'll have patients that come in, and they're coming in often not necessarily as allergies as their main complaint. They're coming in for something else, like, I don't know, arthritis or menopausal symptoms. And then they say, like, oh yeah, my allergies are so bad, and they're already on allergy medicine. They're not necessarily like really getting that much symptom relief from it. And then we'll put them on a natural formula, and they'll come back saying this works better than the over-the-counter prescription they were taking.
Yeah, you know, I when I first met you, my son was on Zyrtec every single day, and he's gotten better as he's gotten older. But we tried this, which is one of your favorites. I'll move the iPad here just so we can see it. But we tried this, and this is Dehist, and this is something that's a favorite in your practice and has been around for a long time.
Yeah, this is one of this company, Orthomolecular. This is, I think, their first formula, or one of their first formulas back in the 80s. And it just works so well. The main ingredients are quercetin. I would say quercetin is probably the main reason why it works so well. It also has some vitamin C, a little bit of bromelain, NAC. But quercetin has been studied in randomized controlled trials. So just like we talked about, like sometimes people equate natural to not scientific, but that's definitely not the case. There are so many studies that support the use of quercetin, and actually the use of randomized controlled trials, which is kind of the gold standard for research, that shows 80% of patients who take quercetin for allergies will have improvement in their symptoms. So, you know, the runny nose, itchy, watery eyes.
Well, the nice thing about stuff like this is you're not going to have side effects. Can you take it while you're taking your medication to see if it works?
Yep. So we'll often add it on for people, and then they feel a lot better. You can use it to replace it, or if you haven't, you know, didn't get the symptom relief the previous year and you're like, I'm going to try something different this year, you can take that. You can certainly take it on its own. But yeah, there's no problem in taking it on top of a medicine if you're already on a medicine.
So right now we're in the first week of May, coming up on Mother's Day, and is it too late? Can you start taking this right now? If you're watching this, I know that you could get it through your practice, or you can search up and get Dehist online. It's an over-the-counter natural supplement.
Yeah, so it's not too late. It might take, you know, it might not be that you have relief within the first day or two taking it. Typically, like in the ideal scenario, people who have like pretty bad springtime allergies, we would get them on this about, you know, 2 weeks before what we anticipate the allergy season is going to be, which certainly varies year to year and is getting like, you know, earlier in the year. But if someone comes in and they're having allergy symptoms and, you know, it's already pollen season, we still would get them going on it, and they would probably have pretty significant symptom relief within 7 to 10 days. And we're dosing it like higher than to start. Like we would do 2 twice a day, which is not a lot of pills. It's certainly more than if you're just taking one like over-the-counter allergy medicine like a Zyrtec or an Allegra. But then the maintenance dose is 2 a day, which is not bad at all.
Okay. Yeah. So there's also a Dehist Junior for the kids. And let's talk about gut health. I know that's huge on social media right now. Everyone's talking about gut health. But you're recommending a probiotic because probiotics and gut health go hand in hand with curing allergies.
Yeah, exactly. So there's a lot of science around this as well, that what's happening with your microbiome especially influences your immune system. So most of your immune system starts in the gut, and depending on kind of the status of your gut bacteria, it can impact how symptomatic you are. So not only do we consider like the pollen counts, people will find when we're working on their overall health and reducing inflammation, doing things like more of an anti-inflammatory diet, that their allergies tend to be a lot better. So we might not even need to be relying on more of like a symptomatic relief, like the D-hist. Like it might be that we've worked on their gut health and gotten them into a much better place, that they find their allergies aren't so bad. Just like acupuncture can do this as well, because acupuncture does balance.
You have acupuncture at your office.
Yep, yeah. And acupuncture has been shown, again, it's been studied in randomized controlled trials, which is always interesting when you see acupuncture, but they do sham acupuncture. So it kind of like the patient thinks they've gotten acupuncture, but the needles aren't inserted. But that's also been shown to improve quality of life and reduce nasal symptoms in patients with allergies.
So I know when you have allergies, you want relief now. And same thing with your kids. If you decide to get D-hist today, when do you start feeling better?
Yeah, like I think within a week.
Okay.
And even some people even sooner. Like I'll have patients that's like, you know, they are raving about this and saying within like a day or two of taking it, they feel a lot better.
Wow, okay.
But it could be up to 7 to 10 days before it's really kicking in.
Okay, so as far as supplements, we're going to get into food too, because that matters. But you have something called Zinase, which you can get at Whole Foods or some better drugstores. Xynase. I've heard of xylitol and gum.
Yeah.
This has xylitol in the nasal spray, and this helps?
Yeah, there's a couple of brands out there that have this. So xylitol, it's basically a saline with added xylitol and a little bit of grapefruit seed extract. And it's mainly the xylitol that really moisturizes. So saline is just good. We think about that for allergies and sort of like rinsing the pollen out of the, nasal passages. But that can be drying. Like if you're adding like salt water, when we say saline, it's like salt water. So it can be a little bit drying, which can be good in allergies because people are congested and the tissue is kind of like inflamed and puffy. But it can also be drying. So layering xylitol on top of that can really help sort of like moisturize those passages so people wouldn't have as much of that dryness because they can have like nosebleeds. They also, another thing we think about xylitol, and there's some clinical studies on this as well, is it can help with preventing infection because it can keep the bacteria from adhering and causing an infection.
Okay, so this is easy. Kids or adults can use this?
Yeah, and that's really nice for like short-term symptomatic relief too.
Okay.
So a lot of times we'll get people going if they're really, bothered with nasal symptoms, we would put them on this nasal spray and the D-hist. So it's kind of like you could think about it sort of as a swap out. Like, if you go to your regular doctor, you end up with like Flonase and Claritin, right?
So instead you do D-hist and Zinase.
Yeah.
Okay. And, again, these are things that people want to work. I know that we have talked a lot about, people might know this if you have allergies, about eating local honey. And I know we did a report in the news recently saying it's not that it can't work, but if you're just starting now, it's probably not going to give you that much relief. Is that true?
Yeah, exactly. So you really want to start that earlier. And there are a lot of anecdotal reports about it. And I've had patients in my practice who really have sworn by it and it's worked really well for them. So I'm a proponent of it, but you're right. Like you need to start earlier in this season and it really needs to be like true local honey. Cause a lot of times people are just going and they're just getting like raw honey and they don't know that it's local. So, and that's another great thing about that is that you're supporting like beekeepers, which is a whole great environmental thing too.
So the reason why you want local is because they're going to have the allergies where you live.
Yes, because it's like those bees are pollinating our local plants. So like if you're getting local honey from Florida, it's not going to really help you here.
Not help us here. Okay, so in May, it's usually a lot of the pollens and the trees, right? Yeah,
so it's grass and it's trees. Trees are probably the biggest part of it, but grass, when grass gets long enough and it has like a little bit of a flower, then that has some pollen on it as well. But most people are getting like the tree pollen that on a dry, windy day, people who have allergies, that's the worst, right? Okay. Like today, if it's raining and you're often not going to have much in the way of allergy symptoms.
Okay. So let me ask you this. Does food matter?
Yes, definitely. So on a couple of different levels. So food matters with respect to lowering your overall sort of inflammatory state. So if you're eating a really inflammatory diet, it's going to, increase kind of like your allergy threshold. Like it's easier to become symptomatic. But then there's also science around if you actually have true food allergies. So we're not talking about food intolerance here, where someone's like intolerant to, like onions or, something. And intolerance is more in the gut. True food allergies would be something like you're actually having a quick reaction to some food in your diet that is what we call IgE mediated. And so that's what, like, seasonal allergies are IgE mediated. So if I take the example of a patient who, and we can test for this. This is
a skin prick
testing.
test?
So this is, so you can do it two different ways. So you can do a blood test, and we routinely do this where we blood test for allergens, like a Northeast allergy profile. So you can actually just have blood drawn, and we can say...
Right at Quest or whatever?
We just send you straight to Quest.
And those are reliable when they come back?
Yeah, very reliable, covered by insurance. It'll cover like whatever you've been exposed to in the last 12 months. So it'll tell us, like, are you allergic to grass, tree pollen, other environmental allergens like dust mites, cockroaches, like, molds, ragweed. It shows us everything. But then we also do a food allergy profile for the most common food allergens. So things like dairy, wheat, peanuts, like various nuts. And if anything comes up positive on that, someone could be eating those foods and they're not necessarily like peanut level allergic, but they are having some histamine release if it is an elevated IgE. So by removing those foods, it will lower your allergen threshold. So you don't have as much IgE like circulating, which is going to make you more sort of like itchy and symptomatic.
Okay.
Yeah.
So what about eating? I've heard that we should eat more dandelion greens and foraging type stuff, and that can help. Like, if we want to do something simple every day, is there something you recommend?
Yeah, I mean, those are fantastic because if we kind of so if we're eating things that are foraged, right? Yeah. Then typically we're eating them pretty fresh, first of all. And those foods also have a lot of bitter components, and they're really good for your gut.
Okay.
So this goes back to gut health.
But don't eat them if you spray your lawn.
Yes, exactly. So if you're having your lawn spray, don't take off your dandelion.
Yeah. But the other thing
those.
is, I know that a lot of times holistic docs will say, try to avoid spraying, or there's some more natural solutions. And I believe you can get dandelion greens at the store too.
Oh yeah, like a lot of times you can go to the grocery store and find them, or certainly like at a farm. A lot of times farms,
Whole Foods
would have them. I've seen it at Whole Foods.
John is telling me, our director. Okay, so we've got Whole Foods has them. Those are things you could grind up in your smoothie every day.
Yep.
Any other things that really matter that we could start taking? I know you always recommend a lot of us take fish oil, but does that have anything to do with helping our allergies?
Yeah, so those are also sort of like immune stabilizing, and in terms of nutrients, it's vitamin D and omega-3 that have been shown to be helpful when it comes to allergies. So even there's another randomized controlled trial that was done on vitamin D, and it was 1,000 units of vitamin D, and just that amount alone, which is not a lot. Like we're often recommending in the Northeast for patients to take 2,000 to 5,000 to get optimal levels, but this was just on 1,000 units of vitamin D. And in this study, it showed a reduction in allergic rhinitis symptoms with that. Yep. And so better immune response. And then the same is true of omega-3s. So of course with omega-3s, it's
quality
hard.
matters.
Quality matters, but you could get that from foods as well, right?
Like
so you
salmon,
could be doing salmon, flaxseed, chia seed, hemp seed, and we can test omega-3 levels too. So just like we can test vitamin D, you can do a blood test called Omega Check through Quest and check your omega-3 levels. And most of the time we check them. If people are not taking fish oil as a supplement, then they're often deficient. But interestingly, some of my highest levels I get back on patients are people who are eating flaxseed or chia seed daily.
Okay.
It really
and a lot of people
builds
like
up.
to do that on their yogurt or in their
Yep.
smoothies. So, I mean, if you don't want to get every supplement, just adding the chia seeds, the flax seeds, that would be great.
Yep.
If you are taking vitamin D, I know a lot of you are doing that already. About 1,000 units daily is what you're looking for.
Yeah, so that's what's been shown in the clinical study that did relieve
You could do
symptoms.
more, but at least
yeah,
that.
so the question is like, if you take more, would you even have more symptom relief? And certainly testing comes in really handy here to really figure out what your dosage is, because it varies for a lot of people.
Okay, so we're going to talk about some other things you need to do in your physical environment just after we take a quick break and hear from one of our sponsors.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit wheelerhealth.org to learn more and take the first step towards recovery today.
All right, well, we're talking about recovering from allergies, and if you're out there sneezing, in fact, I do feel like I'm about to sneeze right now. I'm holding it in for a moment, but they say if you look at the light... Excuse me. You're not alone. I mean, I don't even think of myself as someone who has bad allergies, but I have noticed myself sneezing more recently. There's just stuff in the air.
So that's interesting. So this is something that why we test to figure out, do you really have seasonal allergies, or do you have an irritant reaction to the pollen? So because the pollen counts are so high, especially here in central Connecticut, people can have be sneezing, their eyes can be a little bit watery, and you think, oh, I have allergies. And then we test patients and it's like, no, you actually don't have allergies. So maybe we don't need to be using the histamine stuff. It's more about you might just benefit from a nasal rinse or, those
or a neti
sorts of
pot.
things, a neti pot, something
I mean,
like
the
that.
nasal rinses are sort of, I think, the American way of getting around the neti pot, because the neti pot could be a lot for people. But just doing as far as physical things to do, you want to do a nasal rinse or a neti pot daily, right? Because it helps get the pollen out. It's like a shower for your nose.
So certainly if you have seasonal allergies, doing a nasal rinse would be really great. And then even if you are someone that just has more of this irritant reaction, then the nasal rinse would be really appropriate for you. Other things to really think about, especially in both of those cases, would be if you're spending a lot of time outside, to make sure you shower when you come in.
Yes.
So showering after that, you don't want to be outside and then sleep on your pillow and you've got pollen in your hair, right?
Yes.
And then you got pollen on your pillow. That is not good, right? You're just getting a lot of that load in your system.
So you also can watch the weather. We do that right here on WFSB. You can also download the WFSB weather app, which will tell you. But we have been having a lot of high pollen count days. And you say for some folks who just are really sensitive, that might be a good day when you're watching the weather. Stay inside on that high pollen count day.
Yeah, so those dry, windy days with high pollen counts for people who are really miserably symptomatic. And also I get patients that have asthma, right? And so that's really setting off their asthma this time of year. Those patients were often recommending to stay inside on those days. Obviously, I'm a big proponent of being outside and being in nature. That's really good for you. But there are circumstances where, stay in.
Okay, stay inside.
Yeah.
Now, also inside, you actually do recommend HEPA filters and air purifiers. I don't have an air purifier. My son has asked me for one, and I thought, oh, do you really need that? Does that even do anything?
Yeah, so for some people, it definitely can. So some people are very susceptible to particulate in the air. So that could be really helpful, especially if you're someone, that's another thing, is having your windows open, right? That pollen is coming in. If it's windy, that pollen's coming into your home. So if you are someone with allergies, a lot of patients will keep, or people will keep their windows closed and during the height of pollen season. But using an air filter is going to clean that out of your environment. And so an example, my son was living off campus in this old gross house.
Yeah.
And he doesn't have allergies, but he's just I don't know what's up with this house. It's just, he just feels off in it. So I got him a good quality. I like Air Doctor as a brand. They're pretty good quality, but not crazy expensive.
Air Doctor is an air.
It's a brand.
And it's an air purifier?
Yeah, it's an air purifier. So it has it's reasonably priced, and you would buy it based, like the size of it, you would buy based on like the square footage of the room that you're trying to clean. So he put his on in his bedroom, like this is a 4-bedroom house, and then it will run for a certain period of time until it cleans everything out of the air. And he said it ran like heavily for a couple of hours, and then he could tell the difference walking into the living room versus his room. Like the air was lighter, and in the other room, and they've had like water damage. Like this is not like a real clean house. So
does it take scent out too if you have a weird scent?
Like it would take out, because odor like hangs on to like the particulate in the air.
Okay. All right. So these are things you want to do. Just to review. We want to change the pillowcase. You want to shower when you come inside, change your clothes, because lots of pollen. I know kids especially are in outdoor sports right now. They're in spring sports, so that can be difficult. But, you know, just making sure that, think about the COVID days when we used to take off our shoes, and if you worked in a healthcare setting, they had to take off all their clothes and change.
The garage.
Yeah, the garage change. I think all the doctors were changing in the garage, so this might be a good time for allergies too.
Yes, totally, yeah.
Okay, so just to review, and I'll try and link these on my social media if you follow me at Kara Sundlin. These are your favorites. You want D-Hist. There's D-Hist Junior. Okay.
Right. So that's a chewable, and then it's a lower dose per tablet.
Okay. Metagenics. This is a specific probiotic, Ultraflora Immune Booster Probiotic. This one has the clinical research that helps with allergies.
Yeah. So this is my favorite when it comes to a probiotic that's really for the immune system, and an immune system that is dealing with a lot of histamine, especially. But also for nasal congestion. I'll definitely use this for allergies, but I also use it in the winter for patients that sort of had that like chronic congestion.
Okay.
Or a drippy nose. And I've had patients use that for years and works really well. But for allergies and also complex cases that have like mast cell activation syndrome, some people might know that condition out there called MCAS. This is part of what we put those patients on, but essentially we're dealing with the the mast cell that releases the histamine. This works nicely.
And then you've got the Zinase. Again, this is only about $7 at Whole Foods, or some pharmacies will have it, and this is a xylitol saline. I have a lot of saline at home, but I didn't realize, I know it's good to rinse your nose out, but you're saying just the straight saline can be a little drying, so this will moisturize. Great for my son also, who's always getting nosebleeds. Just always had them since he was a kid.
Yeah, so that should be really great for him. It's also nice, like we'll often have patients when, especially in the height of COVID, and people were concerned about traveling on planes, and I would have them like spray with xylitol, because it can help like to keep bacteria and especially viruses from attaching to the mucosal
so just good
tissue.
Proactive each day. Okay. So again, all of this can be used even if you're on prescription meds right now?
Yeah, no concerns for interactions with like anything.
Okay, so then you take it, if you start to feel a lot better, then you might decide, I want to try weaning off my med and see if it helps.
For sure. Like that's how we work with patients. And then this is where allergy testing comes in handy. Obviously people kind of know like, okay, I have allergies in the spring and fall, or my worst time is in August when it's ragweed season. So this might not be something that people are on year round. Now, we certainly have patients that then have like really bad dust mite allergies, and they're just very allergic driven. And of course we're working on immune balance, but that might be a type of patient that we have it on for longer term. But a lot of times the patients that really just have springtime allergies, this is something we're just using for like a couple of months basically, and then they are not taking it anymore.
So I'm confused because I thought you had to get the back scratches where they like scratch and drop a bunch of drops, and you have to go to an allergist.
So you can do that. So that's still called skin prick testing, and you definitely can do that. That's another option. But blood testing will show allergens that you're being exposed to in your environment over the last 12 months. So if you've been living here like for 12 months, and you can test to look at environmental allergens. And then for foods, it's 6 months. So if you're someone who cut out like dairy in the last 6 months, and we test you to see, do you have an actual dairy allergy, it might not show up. It would be a false negative.
Gotcha, because you weren't eating it. Okay. So the blood test can be helpful. Okay. So, and again, these are not things that I think in general your primary care doctor usually recommends, but this is something that
this would often happen if you went to an allergist. They
or
might
at your
do the
place,
blood test, and then they would do skin testing. It really depends on the allergist. But this is something that allergists would use. You usually don't see primary care doing it. A lot of times it's just kind of like the system where, okay, you've got allergies, we'll refer out to an allergist. But
you kind of do it all.
We deal a lot with allergies, so when we're wanting to know about the foods and really understanding, like, do you really have allergies, and when do you have these, what's your total load, like, to really get a better understanding of each patient.
Oh yeah, a lot of people say, I don't know if I have allergies. You had a good example of this earlier. If you have any kind of fever, it's not allergies.
Right, yes, yeah. Now, you could have allergies and now you've got a cold on top of it. I've certainly seen that. But yeah, so if you're worse when you go outside, also, allergies. That's another indicator. But yeah, if you have a fever and you have these symptoms and it's this time of year, then you probably have a cold.
Okay.
And sometimes that can linger for it could be 2 weeks. But then once we start getting, over 2 weeks and you're still having symptoms and there's no fever, it's probably allergies.
Okay. So we all know the sneezing, all that. I just want to bring up also that if you have skin irritation, I know I couldn't believe this. I'd gone to the pediatrician a bunch of times for my son when he was little, and he had this thing on his face, and we thought it might have been impetigo, this, that. We were trying all these different things. It wasn't going away. And the nice thing about naturopathic doctors and holistic doctors is you're going to look at the kind of what's the root, what's the internal. Yeah. So that was done, and I was told, do you know that he's allergic to hazelnuts and peanuts? And I'm like, no, he eats peanuts. And not anaphylactic, just... And this is at a time when my son was having loads of Nutella, which isn't good to begin with, but he was just really into Nutella at that moment. Yeah. And I was advised, give him a vitamin A every day and remove all hazelnuts. Bye-bye Nutella. Yep. And it just miraculously, within a week, the whole thing cleared up.
Yeah, right.
So that was my first realizing of, wow, food can really matter. And we thought it was bacteria or this or that. Nothing was working with the ointments.
Yeah, because it could be that sounds like a case where it was IgE mediated, that it was really food. And that's another thing is we can see people who are really have what we call atopic disorder, where they have eczema from, environment. It's kind of more of an allergic prone patient, and so sometimes they have the triad where they have seasonal allergies, they have eczema or rashes, and they have asthma as well. Okay. And so then we're really working to really balance the immune system. But yeah, I'll give patients that in the spring can have patchy rashes that just pop up, and it's coming from even seasonal allergies. So it doesn't all have to be kind of up here.
Okay. So good to know, and good to know that there's help. Again, you can see all of these. If you like this podcast, please like and subscribe. If you're watching on TV, thank you as well. We show CURES on the wax and streaming always on WFSB Plus. Dr. Stagg, of course, thank you for being here, and we can follow you at Dr. Stagg.
Dr. Jen Stagg.
Dr. Jen Stagg. That's right. And you can find her at wholehealthwellness.com. I know you are taking new patients at your practice, so if people really want to get a workup, great local resource as well. Have a great day, everyone. Thanks for being here, and be well.
CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.